It is no secret that smoking is bad for you, but tonight we are learning it's even deadlier than we all thought, even though fewer people are lighting up. A new report from the Surgeon General has uncovered that smoking kills 480,000 Americans a year, and not just from lung cancer, but 13 cancers, including liver and colon cancer. Plus, cigarettes are now linked to diseases and conditions like diabetes, arthritis, and even erectile dysfunction. New York City has some of the toughest smoking laws in the country, and we're joined now by the city's health commissioner, Dr. Thomas Farley. Doctor, thank you. What's behind the rise in this, the deaths? Is it because smoking, I don't know, has some reason become more lethal, or is it just because of new research?
Well, first of all, we're now 50 years since the initial Surgeon General's report taught us that smoking causes lung cancer. Since that time, our estimates of the number of people that smoking kills has gone up. Not because cigarettes are any worse, they're just as bad as they used to be, because we know much about smoking. We know that it causes other diseases that we didn't know of before. As you mentioned, liver cancer and colon cancer. Diabetes is a very common disease.
So it's just the research, as I said, we're just learning more about it. New York City has, I watch the television and you can't help but see the commercials. They're very graphic, trying to get people to get off of tobacco. Let's look and then we'll talk about it.
Yeah.
I've had about, I'd say, between 17 and 20 amputations. I used to paint my own house. I can't hang up pictures. The light in my kitchen blew out, and I can't change because I have no fingertips.
There's a government report that estimates that by 2050 that smoking will be as high as 15%. Do you think these ads are effective, or do you think they turn people off because they're so graphic?
You know, these ads work. We've used them in New York City because we developed them with smokers who tell us what speaks to them. What they like are the medically accurate, but very tough, very emotional ads. There's good research to support that they encourage people to quit.
Yeah. What else can the government do besides show ads or to prevent people, to get people to stop smoking or to never pick it up? Are there other things that the government can be doing?
Yeah, you know, there are things that the FDA could do right now that they've been giving authorization by Congress to do. For example, they could set up a system called Track and Trace to find out people who are smuggling cigarettes to avoid the high taxes. High taxes, we know, reduce smoking rates by making the price high so that teenagers don't start in the first place. Yeah. They could also ban the use of menthol in cigarettes. One thing we know is that menthol makes cigarettes even more addictive. Oh, really? And menthol makes it easier for teenagers to start smoking because they get a cool sensation rather than the harsh sensation when they first smoke.
And you're talking about teenagers. Now you want to raise the age to 21, right?
Here in New York City, we've raised the legal sales age from 18 to 21.
But people are saying that because you stopped smoking in all public places. New York was among the first. Now raising the age. People are saying, you know, hey, this is a nanny state. Even if it is bad for us, shouldn't we choose whatever we want to put in our body, even if it's damaging?
You know, people can choose to smoke if they want. I don't recommend that. But what we've done is make it so the environment is easier for people to not smoke. You know, smoking is the #1 underlying killer in America. It's the #1 underlying killer here in New York City. We're saving thousands of lives with the steps we're doing here in New York City. If they went national, we would save millions of lives.